Okay, so here's just some pictures that relate to my life. So the first one is of me and my dad, and then the next one is of me and the varsity softball team. This is our 40 tournament, and this was my first home run of the season, so that was really exciting. And then there's me and my horse Chrome, and then my two brothers and I, Josh and Braden, and then my mom. After high school, I plan to attend Oklahoma State University, and I'm attending the Honors College. I plan to major in animal science, specifically pre-veterinary medicine, and then minor in equine science. They don't have an equine science major, so I didn't really have a choice. I will be applying for early admission into the Oklahoma State School of Veterinary Medicine, which means that I'll get to go in and have an interview and sit down with someone and talk to them about ISM and everything and try to earn a spot. The vet school only has 24 seats for out-of-state students, so I'm trying to get myself a seat now. That way I don't have to stress about it later on. The only requirement is I have to have a 3.0 GPA throughout my entire undergrad. My quote for this year is, "Courage is being scared to death, but saddling up anyways." This is a really cliche, like, horse quote, but every day when I'm at the barn, when you walk out of the bathroom, there's a sign, like, right outside the bathroom. And I usually go to the barn in my Nike shorts and my t-shirt because it's really, really hot. And then I go into the bathroom and I change, and I'm like, okay, like, go out there and just do it. Because a lot of people are scared of horses, so it's like, it's my grandpa's way of motivating my friends, I guess. But anyways, so I decided that it was also going to be my motivation for ISM because it applies to my life. So obviously I had to have some inspiration as to why I wanted to be an equine veterinarian. So it was a horse, and the horse was Barbaro. He was the 2006 Kentucky Derby winner. In the Preakness, he broke down and basically shattered his right rear leg. So he was sent to the University of Pennsylvania New Bolton Center, and they performed a 7-hour surgery, putting 23 screws in a 16-hole plate. I was inspired. I followed his story for a year and a half, basically, and unfortunately in 2007 he died. He developed laminitis in 3 feet, which I'll talk about that later, but it's kind of an aftermath of surgery. When a horse is putting too much weight on the rest of its body, it needs all 4 legs essentially to balance, and when it's overcompensating with the other legs, it causes more problems, and so that was what happened. And so they put him down for his own good, I guess, because his quality of life wasn't up to par. So for my interviews, 4 of the people that I interviewed are from Weems and Stevens, and then the other one is from Lazy Paw. My first interview was with Dr. Cole Skiba. He started at Weems and Stevens in 1999, and then in 2002 he became a partner. Weems and Stevens is the only vet clinic that he's worked at, and that's actually very common for all of the Weems and Stevens employees, which is really interesting. Dr. Julian Hunter is one of 2 veterinarians at Lazy Paw. The other one is her husband, and I think she's crazy because I would never be able to work with my husband. But she made the transition from being an equine vet to a small animal vet in order to make time for her family, which really emphasized the whole time factor to me. It's going to take a lot of my time, and it's going to be a lot of extended hours, and I'm going to have to make sacrifices for my job, and I understand that. One really awesome thing about Dr. Hunter is she plans to go back to being an equine vet once her kids are old enough. And when she was talking to me about being a small animal vet, I could just like tell that her heart wasn't really in it. But then when we talked about being an equine vet, she was just like, this is really what I love doing, and like this is what I believe I was supposed to do. So I'm happy that she gets to go back to that. My 3rd and my 4th interviews were on the same day. The first one was with Dr. Lisa Schultz, and she's the only female vet at Weems and Stevens. She graduated from Purdue, and she also teaches the class at NCTC on Wednesday nights, which I think is really awesome because she really emphasized the idea that just because you're an equine veterinarian doesn't mean that you just have to be a veterinarian. Like, you can go and teach, or you can do seminars, or you can do different things like have interns that work for you. She proved to me that there's like a broader spectrum than just being like a doctor, essentially. And she also changed my mind about being an on-site veterinarian at a U.S. racetrack. Originally, when I came into this, that's what I thought I wanted to do, and she basically told me something that I didn't necessarily want to hear, but I needed to hear. And she said, how many times do you see a horse get injured in a race and then they get treated by the on-site veterinarian? And realize that, and I was like, well, wow, like, never. Barbaro is a prime example. He went to Pennsylvania. He wasn't treated at the track. So her telling me that was something that I needed to hear. And then Dr. Kevin Conch is one of 2 equine surgeons at Weems and Stevens Equine Hospital. He's a graduate from the University of Texas A&M. I've watched him perform multiple surgeries, which we'll talk about that later, but one that really shocked me, I guess, was when I interviewed him. He was performing an eye removal, and he's sitting there and he's like, well, do you want to ask me the questions now, or do you want to sit down and talk about it? And I was like, well, we can sit down and talk about it. You're kind of doing a surgery. And then he was like, okay, well, then I'll just interview you. So then he started asking me questions, and I'm like, dude, can you please focus? Like, you're going to hurt this horse if you don't focus. But he's really awesome, and he's a great surgeon. So my mentor for this year is Dr. Tyler Holtmeyer, who also works at Weems and Stevens Equine Hospital. And this is a picture of us from the research showcase. Dr. Holtmeyer graduated from the University of Missouri in 2012. He interned at Texas Equine Hospital with Dr. Cliff Honest after graduating vet school. And Texas Equine Hospital is actually located in Bryan, which is where I'm from. So we kind of have the same ties. And then he started at Weems and Stevens in 2013. He's also newly engaged, and he loves to hunt and fish. He talks about it every opportunity he gets. One thing that a lot of people ask me about Dr. Holtmeyer is they say, wow, he graduated in 2012, like he's so young. I wasn't really, like, it didn't really occur to me that this should be a concern, I guess, that he's like fresh out of vet school. But now that when people tell me that, I'm like, no, it's awesome, because he is like up to date on all of the medical aspects of it, and he's still learning as I'm learning. So he's able to teach me, but at the same time we kind of learn from each other. Like, he'll be like, what do you think about this? And like, he's up to date on everything. So it's not like the old school vet that's like, you know, graduated 20 years ago. So a little bit about Weems and Stevens. There's 5 veterinarians: Dr. Stevens, Dr. Skiba, Dr. Schultz, Dr. Holtmeyer, and Dr. Conch, and that's also the order that they were hired in. They also have interns from places outside of the U.S. So they have interns from Brazil and Colombia, and they come here to learn as much as they possibly can in a short time period about equine veterinary medicine, and then they go back to their home country and they kind of share it with other people, and they're able to advance medicine in those countries by doing this. It's also a really great family atmosphere, and there's always learning experiences. Like, there'll be times when Dr. Holtmeyer is filing paperwork, and he'll be like, here, how about you go over here and, you know, see what they're up to. And it's amazing how much I've learned just from working with the vet techs and the interns, because the interns are still learning, so it's like, and half of them can't even speak really like awesome English. So it's like I'm teaching them, but they're teaching me, so it's really awesome. And they're really fun to work with. My research for this year started off with my career outlook. Basically, it just gave me an idea of what it was like to be an equine veterinarian. But it's just the facts, like, you know, how much money am I going to make every year? How much school do I have to be in? What am I going to graduate with? Stuff like that. I feel like as much as I thought the career outlook told me about being an equine veterinarian, I didn't really like learn that much about it until I actually started working in the field. And that's what's really awesome about having this mentorship side of things, is because you can never just research a job. Like, you have to be able to experience it to know everything about it. And so I learned that over time. The next one was understanding the horse's engine. So the engine is made up of the respiratory system and the cardiovascular system. This kind of just brought to mind for me that horses are just like people. They have limits. They have a heart that can only pump blood so fast, and they can only breathe so hard. So it really brought that to light for me that, you know, they're not machines, they're animals, and they're living, breathing things. So I felt like this was really important for me to read about. The next 3 ones that I researched were all in relation to horse racing, but that was before I changed my mind. So the first one was about synthetic racing. You know, there's different types of ground that horses can run on, and it just talked about the effects of both of them. The one after that was racetrack fatalities, so how many horses die every year, how many horses are injured every year, what's their cause of death, stuff like that. And then the last one was about track changes in California, and how California is one of the first states to kind of take those steps forward and try to make a change in racing. And then my last research assessment was over advancements in equine medicine. This is from the 2009 AAEP convention, and I picked the 2009 one because it talked about paint horses, and that's what I have, but it talked about deafness in paint horses with blue eyes, which I thought was really interesting. It didn't really occur to me that those things could go together. And then it also talked about the number of unwanted horses and the reasons why they're unwanted. And it's actually really sad. Like, if you look at the thing, it's the biggest one is because they can no longer afford the horse. And that's when I always tell people, you know, a horse is a big financial burden, essentially. And, like, you should know that going into it before you just decide to, like, go in because someone gave you a horse and then, you know, 5 months later it's colicking, and then what? So obviously this has sparked interest for me. So foaling is one of them. We have seen so many foals. It's foaling season, so baby horses are really cute. The next one is orthopedics. Just like there's orthopedic surgeons for people, they have orthopedic surgeons for horses. And I've seen a couple of orthopedic related surgeries and procedures this year, and it's just really interesting to me. And then the last one is dentistry. And I think Dr. Holmeyer is going to laugh at me for this one because, like, he's always like, oh, I'm just going to float teeth, like, it's not fun. But I'm like, no, Dr. Holmeyer, it's fun. Like, what are you talking about? And then one really interesting thing, I actually emailed my horse's breeder because she just had a bunch of foals drop. And so I said, this is my horse, like, I don't know if you know that he got sold to me or whatever. And she sent me a baby picture of Chrome. So isn't that cute? He still has that black spot on his lip too. It's really cute. Okay, so here's a part where we're going to talk about the gross stuff. So I put this blue circle on slides before there are pictures or videos that are disturbing, so to speak. So you don't have to watch them. But I'll try to explain them as best as I can before they pop up, so you're like, you know what to expect if you decide to look. So now we're going to talk about my original work. So at first I didn't really know what to do, but after I put a lot of thought into it, I decided to make a booklet or a portfolio, and I named it My 5 Fears. And I just picked 5 medical related things that I would be really scared if they happened to my horse, because I know that I'm not the only person that's afraid to lose their horse, and I really wanted to clear up any gray areas for people that, like, relate common misconceptions to these things. So the 5 things that I talked about were colic, laminitis, lameness, strangles, and West Nile virus. Colic is basically a tummy ache for horses. It's severe abdominal pain. But what happens a lot of times is these horses, their stomach starts to hurt, and then they start to roll or thrash around or something like that, and their intestines will twist. And so there's a picture of a horse rolling. It's not that bad. But it's also the #1 cause of death in horses, so that's obviously one reason why I'm really scared that it will happen. The next one's laminitis. So the hoof on the left is a normal horse's hoof, and then the hoof on the right is one that's been heavily affected by severe laminitis. So basically what happens is the hoof works where there's laminized structures on the front half, and then in the back there's a tendon, and it's like a tug-of-war. And when the laminized structures get inflamed, they pull it, and it will cause the coffin bone to twist, and it will just cave in that whole front side of the hoof. And so if it gets too far, then the coffin bone will like penetrate the sole of the hoof, and so then you have like a really bad problem. But that's what happened to Barbaro when he started putting too much pressure on his other 3 feet. And then lameness. So just like we get sore or something like that, horses can get sore. So it's oftentimes overlooked because a lot of people are like, oh, my horse is just off today. But really, like, the problem can be a lot deeper than a lot of people would assume. So it can develop in the horse's neck, shoulders, withers, flanks, hips, legs, and hooves. So basically any part, like any major part of the horse's body can go lame. And when that happens, you really want to catch it before it gets too bad, because that can mean some bad things for your show horses and stuff. Strangles is a bacterial infection of the upper respiratory system, and what happens is the horses get these abscesses, and those are obviously popped, so they normally just are covered in skin. And then when they drain out the horse's nose, but it just causes inflammation and swelling of the lymph nodes that can potentially prevent the horse from breathing. The one thing to note about strangles that I'm really worried about when it comes to my horses especially is once one horse at the barn gets it, all of the horses can become infected within a number of hours, really. It spreads really rapidly, and the virus can live for a certain amount of years, like on things on the property. So taking my horse to college is going to be an adventure. And you can vaccinate for strangles, but it doesn't always guarantee that it's not going to happen, just like you can vaccinate for the flu and it doesn't guarantee that you're not going to get the flu. So you never know. And then West Nile virus, it's the same in horses as it is in humans. The only thing is, in horses there's no cure. There is a vaccination for it, and they always recommend that you get it because it is very devastating when a horse gets West Nile. Okay. So my final product for ISM is another separate portfolio made up of research I conducted over the specific medical cases that came into Weems and Stevens. So basically, I didn't want my Jordan's making me laugh. I didn't want my hands-on experiences to stop. So I decided that I was going to do this on my own time and then work with Dr. Holtmeyer during my mentor visits. And so basically I just went up to him and I was like, well, I'll just do my final product at home and then we can just keep doing the hands-on experiences. And then I was going to take what I learned during the mentor visits and then expand upon them in a portfolio and just talk about the different aspects of the different topics that we came across. So the first thing was pre-purchase exams. I talk about these a lot. But so the things in quotations, those are what the papers are titled, so to speak. So I came up with a paper about the basic understanding of a pre-purchase exam. You know, why do we do them? What are the elements of the exam? And then knowing that there's no pass or fail. So basically a pre-purchase exam is what potential buyers will do. They'll bring in the horse and just say, like, I want a thorough exam of this horse. So it just gives them insight on what type of horse they're about to purchase, and it exposes health concerns and risks. So obviously there can be a lot going on with a horse that doesn't meet the eye, and so we try to expose that through a pre-purchase exam, but it's never a guarantee. And that's where the no pass or fail comes in. The vet can't guarantee that the horse is 100% sound, nor does it guarantee that the horse isn't going to go lame or have something wrong with it in the future. Your vet can only advise you for the particular time being. We can't predict the future, so we can't expect that from us. And then as the owner, just facts about what you should expect as the owner. Purchasing a horse is an investment, and we understand that, but we also understand that there's no money back guarantee. And so paying for the pre-purchase exam, like investing in that, is almost, it seems really necessary when you look at it from our perspective, because what's $300 more on a pre-purchase exam when you're already spending $12,000 on a horse? What happens if that horse colics the next day or something like that? So I just inserted that in there. And then guidelines. So what should you do as the owner when you come in for a pre-purchase? So, obviously we want to know your long and short-term goals for the horse. We don't want to do an exam for something that we think is going to be a pasture ornament as opposed to something that you want to be, your next barrel horse or your next performance horse. We also advise the potential buyers to be present during the exam. The vet does call you after the pre-purchase exam is over, but we always advise someone that is going to be a part of the horse's life after it's sold to be there, because it's easier for us to transfer all the information to you like in the moment, as opposed to having to wait until it's all over and then contact you over the phone. And then also, don't be afraid to ask questions. We're trying to help you, obviously help yourself. So, and then for the clinic visits, so for each clinic visit that came in, I made like charts, I guess is the easiest way to explain it. But basically it's just different charts, and each chart has a different thing that goes with it. So there's the information, and so the information, obviously I couldn't include the horse's names for privacy purposes, but there's their age, their gender, their breed, and what they're used for. And then their history would be their vaccinations, their dewormings, their coggins, have they had meds in the past 48 hours, everything that your doctor asks you whenever you go in. The basic health evaluation is very, very thorough. We do their weight, their temperature, we listen to their heart, we listen to their respiratory system, we do a skin exam, we do dental and oral, does the horse need their teeth floated, gastrointestinal, is their stomach making noise. It's always a bad sign if the stomach isn't making noise. So, and then an eye exam, external genitalia, neurologic, and then their overall condition. We don't put them on like a scale, like we don't rate them, but we, does the horse look and sound good from the inside out? And then lameness exam. So our lameness exam, is just examining the horse at the walk and the trot. And we examine for flexion, palpation, and range of motion. So you can see in that picture, she's obviously stretching out the horse's leg, but we do that to see, is there a particular way that you can bend the leg and then the horse goes lame right after that. And so we're checking for everything. And then radiography and blood work, those are extra. You can either ask for them or we can suggest them. It just depends. Obviously, I included just like if we did x-rays, what did we find? And then blood work, a lot of people who are doing trials, which means that they have the horse for a set amount of time, and then they're gonna buy it or not buy it depending on how that set amount of time goes. But they'll ask for a drug screen, and we'll hold the blood for up to 60 days, and then if something happens, like the horse starts to go crazy, we run the blood work, and then whatever we find in the horse's system, we can go back and tell the previous owners, like, look, we found this, so there's obviously a problem. And then what does the vet recommend? What did we find? Like I said, there's no pass or fail, so he can't be like, well, I don't think he failed the vet exam. And like you'll hear a lot of people who are in the horse world say that, oh, he failed the vet or he passed the vet. Well, there's no pass or fail, because then that would come back to bite us, like, oh, he passed, and then, the next day something happens. And then there's the colic exam. So again, I did a basic understanding. So like I said, colic is just a disorder of the digestive system caused by severe abdominal pain. So I read about that. There's different forms of colic, and we try to diagnose the horse as best as we can, but essentially we don't really know what's going on until we open the horse up. But depending on the form, there's a difference between a horse that needs surgery and a horse that doesn't need surgery. And then I also talked about prevention. What can you do to prevent colic? Obviously, don't make any abrupt changes to your horse's environment, to their feed, anything that could upset them and then cause problems. And then I talked about the signs and the options, what to look for. If your horse is doing this, then there's a chance that there could be colic. And then what are the options? There's normally 3 options when it comes to colic. There's either euthanasia, which is the most devastating, obviously, medical management, or surgery. And then I also did the exam. So there's different parts to the colic exam. We usually do the basic health evaluation first, and then we do a rectal exam if we need to check to see if the manure is dry or if the horse is passing manure at all. And then the nasogastric tube, there's a picture of it right there. Basically, we just put this tube up the horse's nose and into his stomach, and if there's an impaction or if there's a buildup of food in there, we try to get it out. It's like instant relief for the horse. And then another use for the nasogastric tube is we pump mineral oil into the horse's stomach, and when the mineral oil passes, you can see it in the manure. So that helps us to know whether or not food is actually going through the system properly. And then findings and recommendations, and I also did charts for those in my binder. And then medical management and surgery, I talked about those. So for surgery, there are obviously different candidates for surgery. There's decision factors like how severe is the problem, what's the likelihood of success, what's your financial situation. Every single vet that I've talked to at Wings and Stevens, they tell me if your horse is colicking and you want to perform surgery, you have to look me in the eye and put $10,000 down on the table, because that's the minimum that surgery is going to cost. And so that's when we say, okay, what's your financial situation like? And it's not a matter of do you love your horse or not, it's a matter of can you afford it or not. And then recovery after surgery. Okay, so these ones that I'm skipping over, I'm still working on these because obviously my final product isn't done. But these are just some of the other topics that I'm going to talk about. So there was dummy foals, pneumonia, there was epiphysitis, which was before that, a tracheostomy, abscesses, and then dental equilibration, which is floating teeth, but this is the medical term for it. So for this one, I did a paper or a fact sheet over the horse's mouth. I basically just included what are the deciduous teeth or the baby teeth, and then what are the permanent teeth, and then I expanded on those. What are their jobs in the horse's mouth? What role do they play? Stuff like that. I talked about common dental problems and recognition, and then dental conditions for both the incisors and the cheek teeth. And then the process. Obviously, when we're floating horses' teeth, our goal is to reduce contributors to wear, eliminate pain, restore dental health, and optimize function. We recommend that over the age of 18 months, horses start to get their teeth floated, especially if they're being ridden. And then how do we prepare for floating teeth? What is the actual procedure? And then what do we do after the procedure? And then for each time that we floated teeth, I made one long chart and they're all together. So obviously I couldn't put the horse's name, but it says like horse number 1, and then it has the date, where we did it at, what we found, and then additional notes. Does the horse need to have his teeth floated again in 6 months? What else, like what all did we find? What do we recommend? So these are some pictures of what I normally look like at Williams & Stevens. I normally stare at Dr. Holtmeyer like he's ridiculous and what are you doing? This is actually at medieval times. And then Dr. Holtmeyer decided one day, well, since you're going to look at me crazy, I'm just going to make you do it, and then I'll look at you crazy. So I refused to wear the headlight, which he was very adamant about the headlight, but I was like, you can shine the light into the mouth. But basically, this is what the drill looks like. So the horse is sedated, and then we put this apparatus on them, I guess. But it basically cups the front top teeth and then the bottom teeth, and it pulls it open, and we just kind of tie it open. Not to where it's like straining them to keep their mouth open, but to where it's comfortable enough for them, and then we can also see into their mouth. And then the drill is really long, and on the end of it, it just has like a little filing disc, and it spins really fast, and basically we just grind down all the teeth, or file them down, so to speak. And it doesn't hurt them, they don't bleed. You could put it on your hand, and it just vibrates really, really fast. But yeah, this is one of the horses that I did teeth on at medieval times. And then after that, we did a castration. So I talked about what's the difference between a stud that has breeding value and doesn't have breeding value. What's a crypt orchid? I don't know if you guys know this or not, but it's a horse that only has one testicle that's out of the body cavity, or both are in the body cavity. So I talked about that because they won't, I mean, some of them are sterile, so you can leave it in there, but it's a chance that, like, it's a risk that you're taking because some of them are fertile and they can still breed mares. So I just talked about how it would be best if you just castrated them. And then the procedure, the castration procedure, what do we do at Williams & Stevens? Obviously, every vet does it differently. And then recovery, and then when should you expect the behavior change? Okay, this is really sad. We had a horse come in with lymphoma, and he was a family horse. So lymphoma is a cancer of the lymphatic system, and there's different forms of it. There's like a general where like it's all over the horse's body, and then there's a specific. So it's like this horse like had a lymphoma mass on his rear end. So it was like under his tail, but like on the inside, but it hadn't gone into his rectum. This particular horse, Dr. Conch actually removed the mass from him, and I was going to try to get a picture for you guys, but obviously this is really devastating for people, so I didn't want to be like, can I take a picture of your horse's butt? But, you know, when it comes to the exam, like, what is the exam actually going to show us about lymphoma? The horse isn't going to be able to tell you that I think I have cancer, and just like people, like, we don't know what's going on. It's not something that you can see from the outside. In this particular case, we could see the mass from the outside, but we're pretty sure that since the mass had already gone to the outside of the horse's body, that the inside was just like, it would have lit up on an MRI. So how are we going to diagnose the horse? Obviously, it depends on the form and how progressed it is. But there's different ways that we're going to have to diagnose this horse. Detection, we can do a CBC, which is just a comprehensive blood exam. We can do a serum chemistry profile. You know, there's different things that we can do. A lot of people don't really want to pay to get their horse MRI'd, and I completely understand that. That would be really expensive, and especially if we don't have insurance. But yeah, and then detection is probably the hardest aspect of this because, like I said, you know, you can't see it from the outside. There has to be something else going on with the horse for you to have to bring it in. Like, the horse isn't going to really show symptoms of lymphoma until it's progressed to the point where there's no going back. And then you have to do confirmatory testing. So normally they do like a biopsy of the tissue, which is what we did with this particular horse, and then, or you can remove it, which is what we actually did, but we biopsied it first. And then there's treatment for it, so you can do chemo and radiation, but it depends on, again, what's the best option for the horse and the owner. Chemo is really expensive for horses, so is radiation, and you know, there's some people who don't even want to put their horses through that because it is really devastating. It does the same thing to horses that it does to humans, and you know, it totally drains them. What are complications? So obviously the horse is going to deteriorate. There could be organ failure depending on how progressed the disease is, like I said, and then they can react negatively to chemo. And then how are we going to monitor it? So how are we going to keep up with the disease and watch its progression? With Dr. Conch, you know, the biggest thing with him is he wants the horse to be as comfortable as possible. And so